In the world of viruses, there's always something new to discover. Scientists identified human metapneumovirus, or HMPV for short, in 2001. This virus is similar to the virus that causes respiratory syncytial virus, or RSV. Like RSV, HMPV primarily affects the respiratory system, causing cold-like symptoms. Most people encounter HMPV during childhood, and repeat infections throughout life are common. While HMPV might be new to the scientific community, it's been circulating among humans for a long time. HMPV often causes mild cold-like symptoms. These symptoms can include a runny nose, cough, sore throat, and fever. However, some people, especially young children, older adults, and those with weakened immune systems, can develop more serious complications from HMPV. These complications can include bronchitis and pneumonia. The symptoms of HMPV can be difficult to distinguish from other respiratory viruses, such as the flu or the common cold. This is because many respiratory viruses share similar symptoms. If you are experiencing respiratory symptoms, it is important to consult a doctor to determine the underlying cause. In recent months, China has seen a surge in cases of HMPV, particularly among children and older adults. This surge has coincided with an overall increase in acute respiratory illnesses, including influenza, in the country. Some hospitals have reported being overwhelmed with patients experiencing respiratory symptoms. However, it's important to note that this is not unusual during the typical flu season. The increase in HMPV cases in China has raised concerns, especially in light of the recent COVID-19 pandemic. However, it is important to remember that HMPV is not a new virus. It has been circulating in human populations for many years. The recent increase in cases may be due to a number of factors, such as increased testing, waning immunity, or the emergence of new viral strains. Despite the increase in cases, there is no evidence to suggest that HMPV is more severe or transmissible than in previous years. The World Health Organization and the US Centers for Disease Control and Prevention have not issued any specific alerts or warnings about HMPV in China. HMPV, like many respiratory viruses, announces its presence through a familiar set of symptoms. These symptoms often mimic those of the common cold or the flu, making it tricky to pinpoint the exact culprit without medical testing. However, understanding the typical symptoms of HMPV can help individuals seek timely medical attention and take appropriate preventive measures. One of the hallmark symptoms of HMPV is a persistent cough. This cough can be dry or produce phlegm, and it may linger for several days or even weeks. Accompanying the cough is often a runny or stuffy nose, adding to the discomfort and making it difficult to breathe through the nose. Fever is another common symptom of HMPV, especially in young children. The fever may be low-grade or high, and it can be accompanied by chills, body aches and fatigue. Sore throat, headache, and muscle aches can also occur, further adding to the overall misery of the infection. HMPV spreads from person to person through close contact, much like its viral counterparts, the common cold and the flu. When an infected person coughs or sneezes, tiny droplets containing the virus are released into the air. These droplets can travel up to 6 feet and infect others who inhale them. Touching contaminated surfaces is another way HMPV can spread. The virus can survive on surfaces for several hours, waiting for an unsuspecting hand to pick it up. If you touch a contaminated surface and then touch your eyes, nose, or mouth, you can introduce the virus into your body. Close contact with an infected person is a major risk factor for HMPV transmission. This includes living in the same household, sharing utensils or drinking glasses, and kissing. Children are especially susceptible to HMPV because they are more likely to have close contact with others and have less developed immune systems. Section 5. Stopping the spread HMPV prevention. While there is no vaccine specifically designed to prevent HMPV infection, several preventive measures can significantly reduce the risk of contracting and spreading the virus. These measures involve adopting simple yet effective hygiene practices that are crucial in limiting the transmission of respiratory viruses in general. One of the most effective ways to prevent HMPV infection is through frequent and thorough hand washing. Washing your hands with soap and water for at least 20 seconds, especially after coughing or sneezing before eating and after using the restroom, can effectively remove the virus from your hands. If soap and water are not readily available, using an alcohol-based hand sanitizer containing at least 60% alcohol can be a suitable alternative. Wearing a mask in crowded or poorly ventilated indoor spaces is another crucial step in preventing the spread of HMPV. Masks act as a barrier, preventing respiratory droplets from spreading through the air. Choose a well-fitting mask that covers both your nose and mouth, and ensure it fits snugly against your face without leaving any gaps. Avoiding close contact with individuals who are sick, especially those exhibiting respiratory symptoms, is essential in reducing the risk of HMPV transmission. If you are sick, it's important to stay home from work, school, or social gatherings to prevent spreading the virus to others. Cover your coughs and sneezes with a tissue or your elbow and dispose of used tissues properly. The HMPV virus and the coronavirus from 2020 share some similarities, but they also have distinct differences. While both are respiratory viruses, HMPV primarily affects children and the elderly. On the other hand, the coronavirus had a broader impact across all age groups. It's fascinating how each virus has its unique characteristics and challenges. Currently, there is no specific antiviral treatment for HMPV. The management of the virus primarily involves supportive care, such as providing oxygen and fluids to those affected. Researchers are actively working on developing vaccines and treatments, but for now, prevention remains key. Good hygiene practices and avoiding close contact with infected individuals are essential steps in protecting oneself from HMPV. The global response to HMPV has been somewhat muted compared to the coronavirus pandemic. This is partly due to the fact that HMPV generally causes less severe illness. However, public health organizations continue to monitor the virus closely. Efforts are being made to increase awareness and improve diagnostic capabilities to better manage outbreaks when they occur. Navigating the challenges posed by HMPV requires a combination of vigilance and proactive measures. Parents and caregivers should be particularly mindful of the symptoms in young children and the elderly. Staying informed about the latest research and guidelines can help communities better prepare and respond to outbreaks. In the end, knowledge and preparedness are our best tools in combating any virus, including HMPV.